Do you know what is eating disorder? Disorders are eating behaviors that endangers an individual's physical and psychosocial health. For an example, it can cause unhealthy eating habit to develop. We want to spread awareness about eating disorder among young adults. Studies have determined that 13% of young adults is struggling with eating disorder. Guys, do you know how many types of eating disorder exist among young adults? So, let's take a look together. First, anorexia nervosa. Anorexia nervosa is a life-threatening eating disorder marked by extreme weight loss, or challenges in maintaining a healthy body weight. It often have a distorted body image, and perceive their weight falsely. The image depicts an example of this eating disorder. Second, bulimia nervosa. Bulimia nervosa is an eating disorder where a person frequently consumes large amounts of food and tries to counteract its effect. Bulimia involves uncontrolled eating disorder called binging. Binging entails consuming much more food than normal within a short period, usually less than 2 hours. People with bulimia restrict their calories in 2 ways. First, purging time, which they induce vomiting or misuse laxatives, diuretics or enemas to eliminate food. Second, non-purging types, which is instead of purging. They use other method like fasting or excessive exercise to limit calorie intake. Third, pica. Pica is an eating disorder characterized by consuming non-food items that lack nutritional value. People with pica crave substances like ice, dirt, soil, hair, cloth or laundry detergent. Last one is rumination syndrome. Rumination syndrome involves the regurgitation of undigested food shortly after eating, followed by rechewing and swallowing or spitting it out. The regurgitated food lacks a sour and bitter taste because it hasn't mixed well with stomach acid for digestion. There are several symptoms of eating disorder which are dizziness, denying feeling hungry, intense fear of weight gain, stomach cramps and other gastrointestinal symptoms, and repeated weighing oneself.
There are several factors that might cause eating disorder. First of all is genetic. This might come from family history or chemical imbalance. Secondly, factor that causes eating disorder is social. It is related to negative body talk and is caused by society's standard of beauty. Lastly, is psychological factor. They might have low self-esteem, and always have an obsessive thinking to achieve body goals.
Treatment. Treatments for eating disorders vary depending on the type and your specific needs. Even if you don't have a diagnosed eating disorder, an expert can help you address and manage food-related issues. Psychotherapy, medications, nutrition counseling, and Maudsley approach are some of the treatments that can help eating disorder. Firstly is psychotherapy. A mental health professional can determine the best psychotherapy for your situation. People with eating disorders improve with cognitive behavioral therapy, CBT. This form of therapy helps you understand and change distorted thinking patterns that drive behaviors and emotions. Secondly is medications. Some people with eating disorders have other conditions, like anxiety or depression. Taking antidepressants or other medications can improve these conditions. As a result, your thoughts about yourself and food improve. Next is nutrition counseling. A registered dietitian with training in eating disorders can help improve eating habits and develop nutritious meal plans. This specialist can also offer tips for grocery shopping, meal planning and preparation. Last but not least is Maudsley approach. This form of family therapy helps parents of teenagers with anorexia. Parents actively guide a child's eating while they learn healthier habits.
That's all from us. Thank you for watching. Don't hesitate to ask a question to us.